Good afternoon. Welcome to today's presentation of management of mental health diagnosis. We'll explore primary, secondary, and tertiary medications, along with the alternative interventions for anxiety disorders, bipolar and mood disorders, personality disorders, schizophrenia spectrum, and trauma and adjustment disorders. This presentation aims to provide a comprehensive understanding of various treatments, options, and highlights the ethical responsibility of the social worker in addressing issues like overmedication and the influence of big pharma. I'm Terrence Dingle. I'm excited to share this information with you today. In this presentation, our goal is to provide an in-depth look at the medications and interventions used to manage these conditions, the aforementioned conditions. We'll also discuss the ethical responsibilities of social workers in addressing broader societal issues related to mental health treatments. By the end of this presentation, you should have a clearer understanding of both pharmacological and alternative approaches to mental health care. Next slide. Anxiety disorders are commonly treated with medications and therapies. Primary medications include Prozac, which increases serotonin levels to improve moods. Secondary options include SNRIs, such as Effexor, which boosts serotonin, and norepinephrine. I don't know if I'm saying that right. Tertiary medications like Xanax enhances the calming effects of GABA, but are typically used short-term due to the potential for dependence. An effective alternative intervention is CBT, cognitive behavioral therapy, which helps patients manage anxiety by exchanging negative thought patterns. Next slide. Managing bipolar and mood disorders can require a combination of medications and therapy. Primary medications like lithium stabilizes mood by modulating neurotransmitter activities. Secondary options include anticonvulsants such as Depakote, which increases GABA activity to help control mood swings. Tertiary treatments might involve, Seroquel, which is an atypical antipsychotic, which affects both dopamine and serotonin receptors. An alternative intervention is interpersonal and social rhythm therapy, which helps patients maintain regular routines and provide interpersonal relationships, crucial for management and mood disorders. Next slide. Treating primary disorders can be complex. Primary medications such as Zoloft increases serotonin to improve mood and anxiety symptoms. Secondary options include mood stabilizers like Tegretol, which reduces excessive neuronal firings. Tertiary treatments may involve typical antipsychotics like Abilify, which modulates dopamine and serotonin activities to help manage symptoms. DBT, or dialectical behavioral therapy, is an effective alternative intervention focusing on skills training and mindfulness, emotion regulation, distress tolerance, and interpersonal effectiveness to help patients manage their emotions and relationships. Next slide. Schizophrenia spectrum disorders are typical treatments for antipsychotic medications. Primary medications include typical antipsychotics like Risperdal, which blocks dopamine and serotonin receptors. Secondary options include atypical antipsychotics such as Hadol, which primarily blocks dopamine receptors. Tertiary treatments might include antidepressants such as Zyprexa, which also affects dopamine and serotonin activity. An alternative intervention is cognitive behavior therapy for psychosis, which helps patients challenge and change unhelpful thoughts and behaviors related to their psychosis. Next slide. Trauma and adjustment disorders can be managed with a variety of treatments. Primary medications include Paxil, which increases serotonin levels to help manage symptoms. Secondary options include Cymbalta, which boosts serotonin and neoprene. Tertiary Treatments might involve prazosin, which blocks alpha 1 receptors to reduce PTSD related nightmares. An effective alternative intervention is eye movement desensitization and reprocessing, which helps patients process and integrate traumatic memories through guided eye movements and cognitive behaviors. Next slide. The social workers have a crucial ethical responsibilities to society. In the realm of mental health, this involves advocating for social welfare, ensuring fair treatment and access to resources. Public participation is essential, involving community members in policy-making processes. During public emergencies, social workers address mental health crisis and ensure care and availability. Social and political actions are critical in tackling issues such as pills, overmedication, and the influence of big pharma on healthcare. Addressing these issues help promote ethical practices and improve overall mental health outcomes. Next slide. In conclusion, we've explored the various medications and alternative interventions used to manage mental health disorders, such as all the aforementioned: anxiety, bipolar, mood disorders, personality disorders, schizophrenia spectrum, and trauma and adjustment disorders. Understanding these treatments is vital for providing comprehensive care. Additionally, social workers play a key role in advocating for ethical practices and addressing societal issues related to mental health treatments. Thank you for your attention. I hope this presentation has provided valuable insight to management of mental health conditions and ethical responsibilities. Thank you.